My name is Nigel Maynard. I am the editor-in-chief of Drugstore News. And welcome back to our ongoing series where we talk to executives and thought leaders in retail pharmacy. Today, our guest is Jenny Zilka. She's the new president of Good Neighbor Pharmacy. Jenny, how are you?
I'm good, thank you. Thank you for having me.
Great, thank you for being here. Before we jump into some meatier topics, can you give us a sense and tell us a little bit about a Good Neighbor Pharmacy and the markets that you serve?
Yeah, absolutely. So Good Neighbor Pharmacy is a franchise program through AmeriSource Bergen, and it is a group of about 5,000 independent pharmacies that are located throughout the continental US, as well as Hawaii, Alaska, and Puerto Rico. And what Good Neighbor Pharmacy strives to do is support those independent pharmacies with some of their back office tasks, right? So these pharmacies are all independently owned, independently operated, but we provide them with services and solutions that allow them to maximize the care that they take of their patients.
Okay. So sticking with that theme, can you describe some of your patient-facing services?
Yeah, so I would love to. So at Good Neighbor Pharmacy, we're very committed to supporting our customers, like I said, those independent pharmacies and the patients that they serve. So we're always continuously seeking to invest in tools and capabilities and services that allow the pharmacies to continue to provide that high level personalized care and the convenience for their patients. So how do we do that? Some examples of some of the services that we provide include digital tools. So really allowing these pharmacy owners to interact with their patients and meet them where they are at. We also know adherence is vital to success clinically. So we do also help them implement maybe MedSync programs, refill reminder programs, things like that, that allow the patients to fill their scripts at the same time every month, which really, leads to improved health outcomes, but also fosters patient loyalty. And then finally, another tool, an example of what we provide is our mobile app. And I think over the last couple of years, we've all gotten very comfortable using mobile apps more than ever. It's become an essential tool for our pharmacy's patients to be able to refill their prescriptions, get medication reminders, even do prescription transfers on their handheld device, and really up the ante on convenience for these patients. So those are some examples of some of the areas that we invest in to help our pharmacies, our independent pharmacies, with their patients and patient-facing services.
Mm-hmm. Now, has COVID testing and vaccination been as big for independent pharmacies as it has for the national chains?
Yeah, it's been huge for us. And it's been a really, obviously this is something I don't think any of us ever expected to be talking about. But our independent pharmacies were pulled forward very early in the vaccination process. And we're just kind of going on 1 year from when we were pulled forward and allowed to participate in the federal vaccine program. And as of today, we've allocated over 5 million vaccine doses to our independents. And, when you think about independent pharmacies, they're so very ingrained in their communities. They know their patients really well. They go to school with them. They go to church with them. They're very active in their communities. So as the vaccine rollout, as it evolved, what we found is our independent pharmacies were not only giving prescriptions in their pharmacies, they were going to people's homes when they were delivering their prescriptions. At times, they were even adding groceries into those deliveries to take care of some of the senior population who was homebound. So they definitely have been able to play a huge role in these communities. And when you think about independent pharmacy, we've always known that they service very rural and underserved markets and everywhere in between. And what we learned through the vaccine is that a very high percentage of their vaccine administrations were in socially vulnerable markets. So that means, maybe places where there isn't another healthcare facility or provider nearby. So they've played a really big role. We're super proud of all the work that they've done. And it's really validated what we've always known, which is that they're accessible and allow for equitable dispensing of both prescriptions and services.
Okay, great. So switching gears a little bit, I know fees and pricing are big issues for the industry. How are you advocating for price transparency in Congress?
Oh, that's such a good question. We are of the belief that in order to preserve this very important and accessible healthcare destination, that we have to ensure that our pharmacists are able to compete in a free and fair marketplace. We also have to make sure that our collective voice is heard. So this is beyond just Good Neighbor Pharmacy and AmeriSource Bergen. It includes our industry and trade partners. It includes our pharmacists. It includes all in the pharmacy ecosystem. So we're very passionate about ensuring that we are continuing to advocate on behalf of these independent pharmacies and allow them to even practice at the top of their license going forward. Let's see, in 2021, we were very active with our industry partners in supporting both the introduction and the passage of bills in 10 different states that represent progress in allowing these pharmacies to practice at the top of their licenses. So despite this is great success. We're super excited about the momentum. There's still a lot of work to be done in regards to DIR reform, in addition to the provider status, like you said. So we'll continue to collaborate and champion policy that supports the viability of local pharmacies, but also enhances transparency, whether it's DIR fee reform, PBM transparencies, and it's really about transparency among all of the stakeholders. And at the end, of course, we want to reduce patients' cost sharing and allow these pharmacies to continue to play the important role that they've established themselves through COVID.
Okay. Now my final question for you, it has again to do with the pandemic. So you've talked about all of the things that independent pharmacies have been doing throughout the course of it. How are the pharmacists and pharmacies poised to help patients with the lingering pandemic now in terms of vaccination, treatment, testing, and all of that stuff going forward?
Yeah, so, like I said, our pharmacies have proven how reliable they are, how accessible they are, and how effective they are at getting high quality, high touch, equitable care to their communities through COVID. We've always known it. This has just shown a light on it, which has been very, I think, encouraging to see. I think when you think moving forward beyond COVID, so when you think about even the patient's journey now that antivirals have been introduced, right? We have these healthcare destinations that are in the community where perhaps as we think beyond the PrEP Act and we think beyond COVID, where a patient could potentially walk into the pharmacy, be tested, test positive, be prescribed an antiviral, and then have it dispensed all in a single place by a highly trusted health member of the overall healthcare team. And again, we really just seek to help and care for these communities. A lot of these patients already go into these pharmacies 30 times a year as they go to get their refills, right? Or they're calling on a regular basis, or they're in there for their families. So they really do have they're a very accessible point of care. And I think as we think about what we've proven, especially in the independent space around social vulnerability, equitability, and ensuring that these whether it's the antiviral or the vaccine or these clinical services, that we're able to get them into the community, into the homes, and into the lives of these patients. So I think there's a lot of learnings and a lot of opportunity as we look forward based on the amazing work that pharmacy has done over the last 2 years. Great.
Jenny Zilka, thank you very much for talking to Drugstore News today. Appreciate it.
Thank you so much for having me.
Okay. Bye-bye.
Bye-bye.